housemate of mine's a radiologist, and he says he doesn't read CTs or MRIs because he said, what do you say? It's a pain in the butt. So I didn't know what I wanted to ask you because I see you do that. And then number two, let's talk about AI's role in all of this as well.
Sure. Yeah. So in terms of CT and MR, I love cross-sectional imaging. So that's like, there's no subspecialties in terms of like human trained radiologists often go on to do a fellowship in a certain area / modality. We don't have that as of yet in our college, but I think a lot of us will kind of self-declare our niches and where we kind of shine and where we like. And MRI is certainly one of mine. I'm a jack of all trades. I read everything, but I really love soft tissue. So ultrasound and MRI is kind of my favorite, if you're going to ask me. In terms of why your colleague's probably saying that, I think it's twofold. One is they're big studies, right? You look at a routine 2 cavity, so a thorax, abdomen, CT. I might be looking at 2,500 images versus 3 from like a catagram or 6 from an abdomen, And so from that standpoint, they are a lot to dig deep into. And then if you add additional parts, like it's been big in oncologic imaging to do whole body CTs, which is just a huge study to read. So that might take someone 30 minutes, 60 minutes, right? And so if you have to pick or choose, like, can you get through 10 radiographs? Like, I think most people would say an average of 10 radiographs an hour, maybe different scale, but let's bell curve it, or 1 CT. And so there's a few things. One is you have to have a passion to sit through that CT. And so if you don't have that, then regrads, right? 2 is business-wise, certainly there's a lot more need and demand and financial incentives often to get through those 10 rads than there is 1 CT, because we can't price ourselves out of the market. And so it's multifactorial. I think a lot of us really like cross-sectionals, and I think we filter in where we can, because certainly the rads are always going to be the highest, because there isn't a lot of people with CTs, and I don't envision that changing in the near future. But a lot of people have radiographs. Almost every vet clinic has an x-ray machine, right? So I think you need to have a hybrid. Like, there are days where I really just want to read rads because it's bread and butter. It's not, let me see if I have a minutia of a lesion in a vertebral spine. But other days where I really want to dive deep. And I think that collectively understanding all imaging modalities helps you interpret ultrasound helps me interpret abdominal rads, heads down. So like, that's the cool thing about radiologists, is we kind of see it in multiple imaging modalities or planes or anatomic locations that may be lost on a 2D image. Everything's interpreted in 3D, and how I can almost guess, I know how this is going to look on CT at this point in my career. And I think that's so cool for me. Yeah, It definitely helps us, even looking at an x-ray, to have that advanced knowledge of additional imaging modalities.
You put a lot into light about time taken and everything like that. Yeah. And the imaging and everything like that, which also, even with our high-speed internet, it must take a lot to get those images to you, right?
Yeah. Well, luckily it's better, because gig internet is prevalent now, or half gig internet. So it's much better to get these studies than I think it has been, or certainly. But if you're reading, like, if you have a house in the mountains and you're reading on satellite, then you're pretty much nixed on some of those big CT studies. You're waiting 45 minutes for that thing to download.
I mean, because that's the going joke in vet medicine is radiologists sit at home with like 6 screens, right? They're in their home with their coffee and 6 screens.
And they're home very close to fiber optic cable lines.
I do have a personal question. So I have a new grad as a resident. And she goes, you got to do 3 views on every rad. So we converted our protocol. But is that, I was trained 3 view for met check, right? Mm-hmm. Or you got to find, if you want to find something in the lung field, but 3 view everywhere. So we do 3 view everywhere. Yeah. And I'm still.
You're not sure.
When that left lateral comes in, I go, what's this? but what is your take on that?
Depends what you're looking at. Like, I'm certainly not bold. I think, all rules have some fluidity in it. You're right. 3 view met check to make sure that you're not missing something subtle, and a lung lobe is ideal. I like 3 view abdomen.
Okay.
And I'll state my claim for that, because the abdomen is soft tissue and gas predominantly. And bone, obviously, on the periphery that makes our contrast. So it's very subtle differences in contrast fat. And so if we can move the gas into different places, it can really help us. So like, especially in a vomiting patient, and this is kind of my, like, if you can't, for whatever reason, do 3-view abdominal x-rays and you're not worried about a GDV, take a left lateral, and either the other lateral or a VD, because the left lateral has so much, like that pylorus, when it fills with gas, can be so telling sometimes on our dogs that have a pyloric outflow obstruction, versus the right lateral where it's just soft tissue, just a big soft tissue mass effect. And you're like, I don't know what's hanging out there. Could be a mass, could be a foreign body, could just be gastric atony ileus. So I think I'm a big proponent of the left lateral. So if you can adjust your culture to a 3, move the left lateral in and grab a VD, or even if the dog's not cooperative, the right lateral. But those movements of gas really help us kind of rule out a lot of the things, because most of the time if you're sending a vomiting patient in, is it surgical or not? Like, that's what I want to know. Is it surgical or not? And so if I just get a right lateral on the VD and this pylorus is fluid filled, I kind of be like, I'm not sure I can tell you is it surgical or not. I need a left lateral. And so I think that's kind of where the, when in doubt, 3 is always nice. It covers your bases. But if I understand how pricing works and how patient cooperability factors into this. So certainly I'm a big proponent of the left lateral abdomen film.
No, that's awesome. I mean, we've incorporated it, and so now you've sold me on it. We had this little dog. Yes, the left lateral gave us a really good view of Loris, and so okay. It's funny. See, now I feel like an old guy because the young student's telling me what to do.
Hey, that's the passage.
Yeah, I know. I think it's awesome.